Okay, so hello everyone. Welcome to the first webinar in GRIO's Public Health series. My name is Matt. I'm a member of GRIO and I'm one of the team leads on GRIO's Public Health project. So for anyone who's interested, we've set aside some time at the end of the presentation for questions. You'll notice, or you may not have noticed yet, but your mics have been muted, and so this is just to cut down on some background noise during the talk. If you have a question, feel free to use the hand raise feature and I'll unmute your mic at the end of the presentation. If you're having any difficulties with your audio, feel free to send me a question via the chat function, either privately or posted to the public space in the chat function, or using the Q&A function, and I can ask on your behalf. We'll be recording this webinar, and I've already started it, so for anyone who can't make the whole thing, or if you'd like to refer back to it at some point, you can email me directly or find the video on our YouTube channel. Sarah's slides will be available upon request after the presentation, so if you contact either Jess or I, we can make sure to send them along to you after the presentation. Okay, so today I have the pleasure of introducing Dr. Tara Elton-Marshall from the Center for Addiction and Mental Health. Dr. Elton-Marshall is an independent scientist with the Institute for Mental Health Policy Research at CAMH, an assistant professor in the Clinical Public Health Division at the Dalhousie School of Public Health, the University of Toronto, and an adjunct assistant professor in the Department of Epidemiology and Biostatistics at Western University. Dr. Elton-Marshall's research evaluates the impact of population-level addiction and substance use-related policies and programs with the goal of providing the evidence needed to strengthen future policy and programming. She's currently leading research to evaluate the impact of the legalization of online gambling in Ontario and to inform school-based problem gambling prevention strategies in the province. So for today's webinar, Dr. Elton-Marshall will be discussing the meaning and application of a public health approach to problem gambling harms and how this framework could be applied to address these harms. She'll also be discussing the social determinants of gambling harm and how these determinants influence the distribution of harms within our communities. Welcome, Tara.
Thank you, and thank you so much for joining us today. I'm really excited to be able to share some work that we've been conducting in this area. So I'm going to talk about a public health approach to addressing gambling harms. And first, I want to talk about the fact that gambling really hasn't been addressed as a public health issue. And this is one of the reasons why we need this kind of work. Traditionally, health agencies such as the World Health Organization don't consider gambling a public health issue. And as a result, there's really no coordinated efforts to address gambling in Canada. But it's a very critical time to actually be looking at gambling and finding ways to address it. And there's a lot of reasons why. One of the big ones is that the gambling field has changed rapidly in recent years. With the development of new technologies and the expansion of legalized online gambling, people can now gamble online anytime, anywhere. So this is an example. In Ontario in 2015, the government actually legalized online gambling, which means that the government now runs its own online gambling website, and this includes the recent launch of an app that is designed for being able to gamble online. And this is just one example of what's already been happening. So you may have heard of PokerStars, for example. PokerStars has been around for quite a while. It uses very slick advertising. They even have PokerStars School that you can go to so that you can learn how to play appropriately and become the next big poker star. It's really become an aspirational thing where people think that they can actually win a lot of money and make a career out of becoming the next big poker star. Think about all the times that you go to a restaurant, for example, and see television sets that have people playing poker on them, and in the background an ad for PokerStars or one of those poker websites. Now think about how recent that is. So the landscape really is changing unlike anything we've ever seen. and yet we really don't know the effects of these changes. We do know, however, that youth are being targeted for these gambling opportunities. So this is an example of an ad from the UK where they use Jack and the Beanstalk, a beloved childhood figure, to advertise their casino gaming. And anyone with any experience in tobacco control, for instance, will be immediately concerned about this because it really recalls the time when Joe Camel was advertising cigarettes that appeal to youth. So we really need to be paying attention to what's happening in the environment and what we can do to address it. Another area of concern is the beginning of blurred lines between video gaming and gambling. So, for example, Star Wars Battlefront 2 came out last Christmas, and it generated a lot of controversy because it incorporated elements of gambling. So you could either play hours and hours to try to unlock components of a game, or you could use real money to open loot boxes. Well, what are loot boxes? These are examples of loot boxes. They've also been called star cards, crates, or battle packs. And the idea is that they have random prizes in them. And they have these tiered, structured pay systems, so people can pay more for a bigger chance at winning bigger prizes. And the loot system for each game aligns very well with the criteria for gambling. So because you buy it for real money, and there is something of tangible value, even though it's of value within the game that can be won, and the fact that there's random determination of what you win, can all be problematic in terms of setting youth up to learn how to gamble and to establish those connections in terms of gambling. As a result of these new loot boxes, different jurisdictions have actually banned in-game loot boxes as a form of gambling. So Belgium and Netherlands have done this already. Minnesota has recently introduced a bill that would ban the sale of games containing loot boxes to children under the age of 18. This is something we really need to keep an eye on because we don't know what the effects are of potentially priming youth for gambling behavior. So with that in mind, we wanted to conduct a scoping review to understand how we can put forward an argument that gambling really is a public health issue that we should be concerned about. And the first way was to really understand how gambling relates to the social determinants of health. So we conducted a scoping review of all the different types of social determinants and what is the relationship to not only gambling but also problem gambling. We also wanted to see how gambling relates to other comorbidities of substance use. So are gamblers more likely to use alcohol or to use other drugs, for example? And then we wanted to identify potential parallels in approaches that could be adopted for gambling. So we have learned a lot from tobacco control strategies, for example, and how could we translate what we know about effective tobacco control strategies into the field of gambling. Finally, we wanted to identify other jurisdictions that have already adopted a public health approach to gambling and see what they've done and how we could learn from that. So I'm going to go through all of that in the context of this presentation. So starting with the social determinants of health, we followed the conceptual framework that was developed by the World Health Organization. And we looked at both the structural determinants, which you can see here, of health inequities, and then we also looked at the intermediary determinants of social determinants of health. So starting with the structural determinants, we considered the following: income, education, occupation, gender, race, and ethnicity. And I'm going to go through each of them now to explain how gambling relates to these social determinants of health inequities. First of all, in terms of income, In general, there is a positive association between gambling and income. So that means that people who have more money are more likely to gamble, which at first may seem like not as big of a deal. High-income households have more disposable income to spend on gambling. This makes sense. And these findings have been replicated even in adolescent studies. So even adolescents who may earn extra income or have higher allowances are more likely to engage in gambling. But the real issue is that there needs to be an examination of proportional expenditures rather than total expenditures on gambling. And that's where you see a different story. So what we find, when we look at proportional expenditures, is that lower income households spend proportionally more of their earnings on gambling. And that those individuals who are lower income are more likely to gamble in ways that have a lot more risk. So in terms of high-risk activities, they're more likely to engage in gambling games that encourage more frequent and continuous participation and allow for the immediate reinvestment of their winnings. So for example, they're more likely to use gaming machines. Low income status is a risk factor for problem gambling. And in terms of looking at different types of gaming, we know that high-income individuals are more likely to participate in online gambling, but it's the lower-income individuals who gamble online that are more likely to be problem gamblers. And one hypothesis is that those individuals with lower income are seeking out higher-risk games online. So they may be spending a larger proportion of their overall earnings on these games. But really, there's a need for more research in this area. The important point, though, is that for public health strategies on problem gambling, we can't focus solely on the amount of money spent or the frequency of gambling, but we need to take into consideration an individual's own income and their ability to withstand financial losses. So for those individuals with more income when they gamble, they have more resources to actually recover from any gambling losses. So the harms are lower than for people who have less income and less resources. In terms of education, there has been an association between educational attainment and gambling, but it's often inconsistent. So some studies have found that those who are lower educated, particularly those who have educational attainment below the post-secondary level, are more likely to experience problem and pathological gambling. But then there have been other studies that have found opposite effects. So some research suggests there's actually a curvilinear relationship among Canadian adults and Greenland Inuit. They found that the highest gambling frequency occurred among those with both the lowest and highest levels of education. So like with income, these findings may be rooted in the fact that a higher education is associated with higher earnings, which provides more resources to gamble, but also creates a buffering effect for any financial losses. In terms of occupation, those who are unemployed or who have lower status occupations may be more likely to engage in gambling in general. So, for example, in one study, they found that people who were in more managerial type positions or professional occupations had lower gambling prevalence and lower gambling frequency compared to those who were in occupational categories that were less stable or who had less skilled employment. There isn't really a good understanding of the causal mechanisms underlying these associations, but one suggestion is that individuals in lower status occupations earn less money and are therefore more likely to gamble to supplement their income. Higher status occupation is also associated with online gambling, but it should be noted that this research was conducted quite a while ago, so it may be the case that at that point in time, people who were in higher status occupation may have had greater access to online gambling. and just the internet in general and technology, that may be changing over time. There may also be changes over time as people have become more comfortable with participating in online shopping and other online activities, and subsequently potentially online gambling. So there's more need for research there. But in general, problem gambling is largely more characteristic of individuals with less stable work environments. Now, it should be noted that a lot of this research is really cross-sectional, so we don't really know if, for example, some of these individuals who are unemployed or who have lower status occupations may have become in that situation because of their gambling problems. So there is really a need to establish what happens over time. In terms of gender, overwhelmingly males are more likely to engage in gambling and to suffer from gambling problems. But what's really interesting is that females are showing a higher rate of progression to problem gambling, and therefore it's really important to monitor this and examine what happens over time, particularly with the rapid changes that are happening in the field of gambling. In terms of race and ethnicity, there has been really limited research. So to date, there is one of the reasons why there's limited research is that it's difficult to conduct this research because you have to have really large samples to look at these subgroups of individuals. But the research that has been conducted has demonstrated some important disparities in gambling-related harms, particularly for those who are racialized minorities or from Indigenous groups. So overall, non-white respondents report having more gambling problems compared to white respondents. And one study actually found that while the number of people gambling is similar across the racial and ethnic groups, the frequency at which people gamble and the rates of problem gambling are higher among Blacks compared to whites or Hispanics. But there's a lack of research really examining the mechanisms for these ethnic differences. There's also some research suggesting that Asian Americans have higher problem gambling rates. And if we look specifically at gambling within Chinese communities, we find that gambling socially is very popular in the community, although research does suggest that the overall prevalence rates are lower among Chinese adults and older adults compared to the general population. There is, however, a rising trend in the prevalence of problem gambling in the Chinese population. And another issue with identifying problem gambling in this community is that Chinese gamblers may be less likely to admit that they have a gambling problem and less likely to seek professional help. And this reluctance is really likely attributable to cultural characteristics such as stigma around gambling problems. Potential reasons for higher rates of problem gambling may be attributable to factors such as early exposure to gambling and media and television that glorifies gambling. So really, any public health approach that tries to address gambling within the community needs to consider what is culturally appropriate and involve development and collaboration within the community. It's also really important that service providers understand the potential role of stigma as a barrier for seeking help, particularly in the Chinese and other Asian communities. Indigenous populations also have higher problem gambling prevalence rates, and Indigenous populations are also significantly more likely to be internet gamblers. Now, it's really important to understand that much of this may be attributable to colonization and the effects of historical trauma, childhood trauma, and social trauma. So any approach to address gambling really needs to be trauma-informed. Racial discrimination is also a significant problem gambling within Indigenous communities. And a public health approach really needs to be community-driven within the Indigenous community and be specific to that community. So we've covered the structural determinants of health and how they relate to gambling. And now we're going to look at the intermediary determinants of the social determinants of health. Intermediary determinants of health are what shape health outcomes. So the main intermediary determinants that we considered for this project were material circumstances, which we defined as being housing and neighborhood quality, the psychosocial circumstances, and in this case we focused on mental health, behavioral factors, and in this case we looked at nutrition, obesity, and physical activity, and then we also looked at other behavioral factors related to tobacco consumption and other substance use, and finally we looked at age. So in terms of housing and neighborhood quality, overall neighborhood disadvantage is so significantly associated with not only gambling, but also problem gambling and pathological gambling. And that might not be that surprising when you consider that individuals who are from more disadvantaged neighborhoods are more likely to be exposed to gambling. So one study in Montreal looked at the distribution of video lottery terminals. Video lottery terminals have been highlighted as an area of concern, particularly for being more harmful. And they found that those who lived in more disadvantaged neighborhoods were more likely to have a clustering of these VLTs. These VLTs have also been found to be located near schools in low SES neighborhoods. And we know that problem gambling is highest when you have both the neighborhood disadvantage coupled with the low socioeconomic status. So public health approaches to gambling really have to consider what is called the spatial distortion of gambling opportunities. So that the fact that those in more disadvantaged neighborhoods are more likely to be exposed, and how that exposure may further exacerbate any issues. And we really don't, at this moment, understand the relationship here about whether gambling-related opportunities are higher in disadvantaged communities, and then that leads to more problems with gambling, or whether or not these communities are targeted for gambling opportunities because they're more likely to be used within these communities. So there needs to be more longitudinal research to understand the impacts. There's also very limited research on gambling and homelessness or housing instability, but from the research that has been conducted, the problem gambling prevalence rates are startling. So one example is some research by Dr. Matheson that found that 25% of people in a Toronto homeless shelter experienced problem gambling. That's much higher than what would be at the population level. And similarly, high rates have been found among Canadian homeless youth. Again, there's a lack of longitudinal research to be able to understand the direction of the relationship between gambling and housing instability. So is it the case that people who have more gambling problems eventually end up homeless, or that people who are homeless are more likely to seek out gambling opportunities as a way to escape their life circumstances? Next, we looked at psychosocial circumstances related to mental health. And we found that overwhelmingly, gambling and problem gambling are associated with a host of poor mental health outcomes. So according to 2 systematic reviews and meta-analyses of studies assessing treatment-seeking gamblers, Axis 1 disorders on the DSM-4 are those that are the most highly associated with problem gambling, so especially mood disorders and anxiety disorders. But also, problem gamblers are more likely to report major depressive disorder, dysthymic disorder, mania, generalized anxiety disorder, and phobias. And problem gamblers are also more likely to have antisocial personality disorder. Again, the majority of the research is cross-sectional, so we don't really understand the temporal association between gambling and mental health. It may be that people with poor mental health are more likely to gamble, or that gambling and problem gambling in particular lead to poor mental health outcomes, or there could be more of a back and forth. So you could imagine that individuals with mental health issues such as depression may be more likely to gamble, but their gambling, particularly if they lose a lot of money, may exacerbate their mental health problems even further. We really need better research to look at these temporal effects over time. Next, we wanted to look at how nutrition relates to gambling, and there has been very little research on this topic. So we did find one study that found that the intake of dietary fat and sugar was higher for individuals who had pathological gambling. But there's really a lack of research to explore the mechanisms behind this association. And one theory is that impulsivity might be the cause of both factors, but we don't know if it's that or if there are other environmental factors. The other thing that we were really surprised about is that we thought that there would be research related to food insecurity. So we thought that maybe those individuals who have more gambling problems are more likely to go without food or go without nutritious food if they suffer gambling losses. And yet there was no studies that have looked at this to date. We also thought it might be possible that individuals who experience food insecurity may have greater gambling losses. Perhaps food insecurity could affect cognitive impairment and decision making, but again, there hasn't been any research on this topic, so it's a really important area to consider. We looked at other behavioral factors, including obesity and physical activity, and overall we did find that gamblers tended to have a higher body mass index compared to non-gamblers, and this was the case in both youth and adult samples. And problem gamblers are more likely to be obese. Although numerous studies have replicated this association between gambling and obesity, we don't really understand the causal link between the two constructs. We did want to explore how physical activity could relate to that, and there is some research suggesting that gamblers are less likely to be physically active. But on the other side of the coin, we wanted to understand how this might relate to sedentary behavior. And really, there's been a lack of research in this area, particularly looking at sedentary behavior and gambling for adolescents. There is a little bit in terms of sedentary behavior and research with adults. What's really interesting is with the legalization of online gambling, we might expect, and especially also with the emergence of the blurred lines with video gaming and gambling, that adolescents in particular might become more sedentary, particularly as they get drawn into more screen time. So this is a really important area for future research, and particularly in this context of the recent legalization of online gambling. I'm actually currently supervising a graduate student, Mary Frances Carton, who will be exploring these relationships for her thesis. Next, we wanted to look at substance use and how that relates to gambling. And overwhelmingly, there's a lot of research showing that gambling and problem gambling are highly related to binge drinking, cannabis use, and smoking in both adolescent and adult populations. And I'm going to go through a little bit of our own data, which is Ontario specific, to be able to provide some recent context to these findings. So for example, we conducted a study among youth in grades 9 to 12 in 3 provinces. They were provincially representative surveys, and we looked at how problem gambling specifically related to different substance use. So first we looked at how binge drinking once a month or more related to problem gambling. And you can see that the bars on the right represent the highest level of problem gambling. The middle bar represents low to moderate problem gambling, and the yellow bar represents no problem gambling. So you can see that there's a very wide dispersion between those individuals who have no problem gambling. Only 29% reported binge drinking once a month or more. And then those who are considered high problem gamblers, 62% almost, reported binge drinking once a month or more. Turning to cannabis use, we also compared rates of cannabis use once a month or more, and those who had no problems with gambling, only 20% used marijuana once a month or more, compared to 68% of those who had high gambling problems. This is a really important area to look even further at, given the fact that we've had legalization of online gambling that has recently happened in 2015, coinciding with the upcoming legislation of cannabis. So what we're going to do after this, I'll go through some of our recent findings, delving even deeper into these relationships between gambling and cannabis use, given how timely it is. Next, we looked at current smoking, and the rates of current smoking are much higher for those who are considered high problem gamblers, 38%, versus those who have no problem gambling, 8%. And then we had an overall measure of substance use risk. So this is looking at likelihood of an adolescent actually being at risk for substance use. And again, the disparities are alarming. So we have 77% of high problem gamblers being at risk for other substance use versus 33% of those who have no problems with gambling. Now, I promised to talk a little more about our findings related to cannabis use and gambling severity. So what we did is we actually delved further and looked at the frequency of cannabis use, because we would be less concerned about cannabis use once a month or more versus more frequent use. And so we broke it out according to whether or not they had used cannabis never or not in the last year, less than once a week or more, indicating more of a pattern of problematic cannabis use. And again, what we found is a very wide disparity between those individuals who have high gambling problems, represented by this bar here. Almost 50% use cannabis once a week or more, compared to those who had no problems with gambling. Only 8% use cannabis once a week or more. So what will be really interesting and important to keep an eye on is what happens with the legalization of cannabis, and especially as these youth age out to become able to legally access online gambling and other gambling opportunities at the same time that they're able to legally access cannabis. We also had a look at whether or not cannabis use frequency differs according to the type of gambling that adolescents are engaging in. And in this case, we looked at people who are non-gamblers compared to those who only gamble in land-based gambling venues, and then finally those who are considered online gamblers. So these would be any adolescents who had reported gambling online in the past 3 months. Now, they could also use land-based gambling opportunities as well, but they had to have also tried online gambling. And what we found is that those who had tried online gambling were the most likely to report using cannabis once a week or more, so 20% compared to non-gamblers at 7%. So again, this points to the importance of looking at the convergence of the legalization of online gambling and cannabis. Now, we also looked at how problem gambling and substance use relates for adults, and for this we used another study that we had conducted looking at people in Ontario, Nova Scotia, PEI, Newfoundland, and Labrador. And the same pattern emerged. So those individuals who were considered moderate to high problem gamblers were much more likely to report binge drinking in the past 6 months, so 60% versus 40%. To report cannabis use in the last 6 months, we had 31% versus 10%, and overwhelmingly to report being smokers. So 44% of those who were moderate to high problem gamblers were smokers, compared to 16% of those who didn't have a problem with gambling. And when you think about the overall prevalence rate of smoking in the population, that's pretty high. Next, we looked at how age relates to the social determinants of health. And we find that older adults represent the highest proportion of gamblers. Now, there's a concern with this because older adults have very unique life circumstances that make it more difficult to overcome gambling losses. So many older adults are retired and may have very limited resources to be able to recover from any gambling-related financial losses. Older adults are also more likely to be able to go gambling because they have more leisure time, and there are bus trips taking them to the casinos. And gambling has been reported as a way to overcome the social isolation that they may be experiencing and the loneliness. So it's a huge potential motivator for them to gamble, but it also potentially makes them more vulnerable to problems with gambling. We also find that youth are particularly vulnerable to problematic effects of gambling. And this may be surprising to some because technically youth aren't supposed to be gambling, but they're finding a way. So Canadian estimates suggest that about 61% of youth and young adults gambled in the past year alone. They're mostly participating in unregulated forms of gambling like dares and challenges, but they're also accessing regulated forms. And in particular, I mentioned the concern about online gambling. Well, we have two different studies that looked at the prevalence of online gambling. One that looked at the prevalence among adults, which is on the left here, and one that looked at adolescents on the right. What we find is that the rate of online gambling is substantially higher among adolescents, which suggests that there may be a looming issue here. So 9.5% of Ontario adolescents had gambled online in the last 3 months alone. And this is compared to online gambling rates of 4.7% among Ontario adults. And that time frame was much longer. It was actually 6 months. So it suggests that we really need to pay close attention as gambling continues to merge with new technologies and as these youth grow up to be able to actually even more easily access these online gambling opportunities. So to summarize, we looked at the different social determinants of health and how they relate to gambling, and we found that overwhelmingly individuals are most likely to gamble and experience problem gambling are those from more disadvantaged groups. And we related them to each of the structural determinants and intermediary determinants of health. So the real issue then is one of health equity. And health equity has been defined as the absence of systematic disparities in health or in the major social determinants of health between groups with different levels of social advantage and disadvantage. So if we're really worried about addressing health equity, we should be addressing gambling. And how can we go about doing that? Well, to date, the WHO report has indicated that in terms of the research that has been conducted, it has been really oriented towards devoting more time to explaining health inequities rather than to actually designing and evaluating policy interventions that can actually address those inequities. So what they suggest is that we need to focus on research evidence that moves towards what is called a solution space. And that is looking at the drivers of reduction in health disparities, the differential effects of policy interventions, and the impact of alternative options for enhancing equity. So we really need to start considering what policy options are available in terms of gambling and how might they impact different equity groups. The great thing is we don't have to reinvent the wheel on this. We can learn from other public health approaches. Strategies to address gambling-related harms can be incorporated into existing public health initiatives that focus on social determinants of health and other substance use, such as alcohol, tobacco, and cannabis. Many of the measures that have been developed for addressing these substance uses could be adapted easily to inform strategies related to gambling. And we could be using existing public health frameworks to address gambling. The other important point I think there is to make here is to consider gambling along a continuum. And this is an infographic that's a work in progress from GRIO. It's being updated at the moment to incorporate more recent evidence. But the point that I really wanted to make here is that to date, we have really focused on the problem gambler, waiting until people come to this very end of the spectrum, instead of considering how we can address people earlier on. How can we develop primary prevention programming before people actually experience problem gambling? We don't wait for people to become alcoholics before we address issues related to alcohol use. So why are we waiting for people to have problem gambling before we do something about it? So really, we need to consider the full spectrum of gambling-related harms through a public health lens. And one way to do that is to consider what has been done in tobacco control, because tobacco control has had many more years of evidence ahead of it, and many of the ways that we've addressed tobacco use that have been very successful could easily be adapted to gambling. One of the most significant advances in public health has been the development of the Framework Convention on Tobacco Control. This was the first international treaty negotiated under the World Health Organization. It's evidence-based, and it uses regulatory strategies to address addictive substances. And many of the recommendations that have been made could easily be adapted or incorporated into a strategic framework for a public health approach to gambling. And in fact, this has been identified as a real need among many gambling experts. So what I did is I took elements of the Framework Convention on Tobacco Control that I thought would apply to gambling, and I've gone through and provided examples of where I think these measures could be adapted for gambling. And they're related to everything from price and taxation to research, surveillance, and exchange of information. So I'm going to go through each one and an example. So first, thinking about price and taxation, there have been suggestions that we implement a maximum bet allowance. This would yield smaller losses for each individual and would reduce gambling participation. But research has also found that an added bonus is that it could decrease alcohol and tobacco consumption. There's also the option of implementing taxation on winnings so that there's a way to feed those resources back into research, and also so that people are not winning as much. It may discourage gambling behavior, but there is caution that is warranted with this approach because we don't want to push people into an illegal market. Often these illegal websites, such as PokerStars, for example, don't have the responsible gambling tools that our government-mandated website like PlayOLG has. They don't have the harm reduction mechanism, so it could, over time, negatively impact problem gambling rates. There are lots of ways that we could be regulating gambling content. So a recent systematic review demonstrated that pop-up messages on electronic gaming machines are a really effective harm reduction tool. And those pop-up messages could deliver really important information, such as facts about slot machines, how they work, information about the risks associated with gambling, or even reminders to gamblers about the time and money that they've spent gambling to break up the gambling play. Another effective strategy would be to regulate gambling content by setting mandatory limits on maximum bet amounts and using behavior tracking technology to be able to enforce these mandatory set loss limits and to identify who are the individuals that are experiencing the most problems with gambling, where are their problematic gambling patterns, and potentially intervening. There are also important changes to the structure of the electronic gaming machines that could also be done. So, for example, slot machines often have what are called reinforced small wins. So it looks like someone has won when in fact they've actually had a net loss. And these are described as losses disguised as wins. And they're really problematic because consumers think that they've actually won because they're usually accompanied by some kind of audio-visual feedback like lights and sounds that are usually associated with winning. So they're really misleading. And so one regulatory approach would be to not allow auditory feedback, to not allow these losses disguised as wins. Another strategy that has been proposed is to have animations about these losses disguised as wins to reduce people's misperceptions of these wins. Another opportunity is to regulate the gambling environment itself. So there are some environments that allow complimentary food and beverages, and in particular is problematic when alcohol is complimentary. It's been associated with a greater likelihood of problematic gambling. So these are opportunities to ban these complimentary food and beverage services. Now we can also turn to ways to regulate the packaging and labeling. In tobacco control, I'm sure many of you are aware, they've developed very effective warning messages, and Canada is one of the leaders on this. We can translate that into gambling. So we could have warnings that are brief, direct, easy to understand, and interrupt play, particularly for electronic gaming machines. The focus of the warnings should also be tested on gambling advertising. We also should look at regulating misleading practices or language. So as I mentioned, the losses disguised as wins is one way, but another is these demo games. And for those of you that haven't heard of these, they actually are free games that simulate the gambling experience that many people use as practice before they go and try the real thing. But what they found is that in many of these demo games, the rate of winning is much higher than it actually is when you pay for money. So people get this expectation that they're going to win big and go ahead and try the opportunity for money where they're more likely to lose. So banning that type of thing. Also, there needs to be better regulations on misleading advertising or vague advertisements such as free bets. What does free bets mean? And the British Gambling Commission actually introduced codes of practice for this to make sure that the consumers were protected from these misleading promotions. Next, we wanted to look at education, communication, training, and public awareness. So one of the issues is that gambling has been referred to as a hidden addiction. Part of the reason is that people who suffer from gambling problems, they don't usually go and get help for those problems. That is because they often want to hide from the stigma of gambling. Gambling has really been seen by society as a benign recreational activity, and this is reinforced with positive and glamorous portrayals in the media. But because of this, because it's hidden, people often aren't aware of those individuals that they may know who suffer from gambling problems. As a result, there's a real underestimation of the risks of gambling, and stakeholders who you would hope to engage in this type of work, such as parents and teachers, don't see gambling as a priority because they often don't know that it's happening. So there needs to be better public education about the issue and more conversations like this where we talk about why gambling is an important public health issue. We also need to look at restricting gambling advertising, promotion, and sponsorship, particularly those opportunities that target children and adolescents. At the very least, we shouldn't have sponsorship of events that are geared towards children by gambling operators, and no advertising for gambling in venues that are primarily attended by minors. We also need to restrict any incentives such as bonuses that encourage further gameplay. And we need to work on counter-marketing strategies. So you can see a couple examples of some of the slick advertising that is available, for example, PokerStars. And they explicitly say that they make millionaires. They're really selling a dream, that poker is a sport of courage, conviction, and confidence. Anyone who has experience in tobacco control knows that the most effective campaigns were those that were denormalization campaigns, focused on the industry and how the industry manipulates young people. We need this type of denormalization campaign for gambling. We also need demand reduction measures. So this includes increasing knowledge about the gambling harms among healthcare professionals, social and community workers, and screening for gambling when you're screening for other substance use and mental health issues. So oftentimes people who have gambling problems have other problems, as we've noted, and those other problems may take precedence. So you may not mention your gambling issue if you have another more pressing mental health or substance use issue. However, if frontline workers are trained to actually do screening at the same time, they may be able to catch individuals who are experiencing problems. And we also need better integration then of those treatment services that are provided, so that once it is identified that someone has a problem with gambling, they can obtain the treatment they need across multiple sectors. So there's a really good example of this with the Department of Justice in Victoria. They actually have integrated treatment systems across services, everything from, gambling, alcohol, and other substance use to mental health and other family service sectors. So this kind of coordination would allow people to get the help that they need instead of having to knock on multiple doors to get that help. We can also regulate accessibility. So we have LCBOs so that people cannot get alcohol any time of day, although that's becoming less so now. But we don't reduce operating hours for casinos. They're open 24/7. We could work on actually reducing the operating hours, and we could also remove ATMs so that people can't continue to take out money and limit the amount of withdrawals available. And then there's also been discussion about whether or not we should increase the minimum age for gambling. So is 18 still the most appropriate age, or are individuals more likely to experience problems, particularly within the transition age, the young adult years, and is it therefore important to protect those individuals from gambling opportunities until they're older? And finally, I may be biased in saying this, but a really important factor is to look at how to improve research, surveillance, and exchange of information. So right now, we have a lack of ongoing surveillance data in Canada, particularly for adolescents. So even though we've had these rapid changes in the technology, the policies, the sponsorships, and the targeting to youth, we don't really know what impacts that is having over time, because we don't have the surveillance data available to monitor that and to respond with appropriate interventions. So I have provided an example here. Down here you can see this is a recent sponsorship partnership that was announced between Kevin Hart and PokerStars. And for those of you who don't know, Kevin Hart is a very famous Hollywood actor who appears in a lot of youth-oriented movies. And I don't think it's, and he also has a high Twitter following. I don't think it's a mistake that they chose him as their brand ambassador. So we need to pay attention to these sponsorships. there's also a lack of international coordination. So we could be learning from other jurisdictions, particularly those that have treated gambling as a public health issue, about ways that we could be addressing gambling within Canada. So I want to provide a couple of case studies of those areas where they are treating gambling as a public health issue, and I'm going to start with Australia. So Australia actually implemented the National Framework on Problem Gambling, and the reason why they did this is that they had a lot of growing concern about gambling prevalence, that it was increasing, and there was this natural push and pull between the desire to do something about the gambling prevalence rates, but also understanding that there are economic benefits to gambling, particularly as a source of revenue for governments. So they developed a strategy that focuses not just on the individual, as we have, but also includes the community and the gambling environment, and it's preventative rather than reactive. So there's 4 key areas of focus that they looked at, and the first was public awareness, education, and training. So the central objective of this was to transparently inform individuals and communities about what's available in terms of gambling products and activities and the odds of winning a particular game. But they also talk about the potential harms associated with each of these activities. And a second aim was to increase awareness about what help and support resources were available so that they could help diagnose early problem gambling. And I'm just going to give you an example of one strategy that they've recently implemented. So in March of 2018, Australia banned betting ads, and the rationale was that gambling ads were occurring during live sport broadcasts that were often viewed by children. So children were exposed to a lot of ads for gambling. So they actually banned from 5 minutes before a game to 5 minutes after a game, there were no gambling ads allowed. They also focused on responsible gambling environments. So this means minimizing the likelihood that gamblers would develop problem gambling. It includes assessments of the ramifications of adding a new gambling activity or venue, and what the impact would be on the surrounding community, often with social impact assessment strategies. So imagine if before we put in a casino, we went into the community and saw what was happening in the community, what potential impacts there would be, and actually did something about it. The framework also has certain codes of conduct that have to be followed. Next, they looked at intervention counseling and support services. And a central objective of this area was to focus on developing support, counseling, and treatment services that are accessible, effective, and sensitive to diversity. So according to this framework, the services would be tailored to all residents of Australia, including those who live in remote areas and Indigenous populations. It also includes a standardized assessment tool to be able to diagnose problem gambling. And then finally, they have a program that allows for national research and data collection so that they'd be able to monitor the impact of their intervention strategies over time. Next, I want to consider the case of New Zealand. So New Zealand actually officially recognized gambling as a public health issue in the 2003 Gambling Act. And they have 3 key areas that they focused on. The first was harm minimization, which involved making changes to the gambling environment to have an impact on harmful consumption. So some examples included they limited the stakes and prize money available. They displayed odds of winning on different games. They wouldn't accept $50 or $100 bills, and they didn't allow ATMs in gambling areas. Next, they looked at health promotion, and they emphasized the importance of community-led action, and it was influenced by the Ottawa Charter for Health Promotion. So this involves developing community capacity, knowledge, and resilience to gambling, and empowering communities to deal with the future gambling opportunities. Examples included displaying pamphlets and signs for gambling services in gambling establishments, collecting problem gambling taxes to contribute to public health services, such as future advertising campaigns, research, and evaluation. So dedicated infrastructure for research and evaluation. Finally, they recognize the political determinants. They recognize that there's a conflict between gambling profits and the government's need to control problem gambling. So this included public health advocacy, mechanisms of surveillance, and ensuring that there was structural accountability to make sure that there was more transparency in terms of government profits. So in conclusion, we looked at existing approaches in terms of how we address gambling, and we find that it really focuses on the individual and ignores the physical, cultural, social, and environmental contexts, which we know are important. We've also demonstrated that gambling is important if you're going to consider social determinants of health. We also know that we need strategies that address multiple substance use and addictions, including gambling. So it doesn't make sense to develop resources that just focus on gambling and resources that just focus on tobacco. We know that those individuals who require those supports, many of them are clustered in the same group. So we could be doing an intervention that addresses both. We have already learned lessons in other substance use that could easily be applied to gambling, and I provided many examples here. And we really should be considering how to implement a public health approach that's consistent with Australia and New Zealand, for example. So I want to acknowledge my funders, including GRIO, the Ontario Ministry of Health and Long-Term Care. I want to make sure that I point out that the views expressed in this presentation are my own and do not necessarily reflect those of the Ministry of Health and Long-Term Care. I want to acknowledge my research team who helped with the report that we developed that was the basis for this presentation. And I also want to point out that as part of our Ministry of Health and Long-Term Care funding, we're actually collecting data related to online gambling behavior among adolescents and also what is more problematic in terms of online gambling behavior among adults. And the purpose of that grant is really to inform curriculum that will be related to online gambling prevention development in schools. It's required as part of the curriculum. But as part of that, we'll be collecting a lot of data related to online gambling behaviors and related to things like video gaming and gambling. If your organization would benefit from any of this research, please reach out to me. As part of the grant, we actually will work with organizations where possible to provide them with evidence as needed. Okay, great. Thank you.
Awesome. Well, thank you so much, Tara. That was an excellent presentation, and I know I can speak for everyone when I say that this is definitely a highly relevant topic, and I think that public health approaches to addressing gambling harm will become increasingly relevant as we continue to see health units and other community health organizations take on gambling harms within the context of their work. Now I'll open up the floor to any questions. If anyone has any questions, you can feel free to use the hand up function so I can turn your audio on. Otherwise, feel free to use the chat or the Q&A functions on the side. And yeah, if you have any questions for Tara, feel free to ask them at this point. Okay, so I'm not seeing any questions up for now. So I guess so I have a question. So we know generally that gambling harm hasn't effectively anyway been considered a public health issue at the systems level, at least through legislation that mandates it specifically as an issue. And we know that there are some barriers to gambling being considered within this context. One of these, off the top of my head, being funding and manpower limitations at different organizations, especially with emerging issues in the spotlight like the opioid crisis and marijuana legalization across the country, what are some other barriers that might prevent organizations from getting down to brass tacks and applying a public health perspective to gambling harms?
Well, I think there's a few. I think I touched on the fact that gambling is really seen as something that's socially acceptable, that isn't really an issue, it isn't a priority. So the first part is just about generating awareness. And people may not even be aware of what's going on out there. I think that particularly with adolescents, there's this perception that you don't have to worry about adolescent gambling because they're not allowed to go to a casino. But that's just one aspect of gambling. And so when we actually look at the rates of gambling, they're actually pretty high. And I think there's also structural barriers. So getting down to, I think, what you touched on in terms of financial and resources. But again, I think when you consider the fact that gambling often aligns with or co-occurs with other addictive substance use, with other psychosocial problems, for example, if you're addressing one of those factors, you could be considering how to implement gambling as part of that strategy instead of, you know, having to shift your resources just to focus on gambling.
Yeah, for sure. Okay, so I was just popping up here. We have another question from Oliver. Oliver mentions he requested that you comment on the delivery of gambling-only interventions versus addiction interventions, whether substance and behavioral. So the latter seem practical for organizations, while the former, gambling interventions, appear necessary to address specifically gambling.
That's a good point, and certainly I don't think there's been any research to be able to kind of pit the two against each other to see what is more or less effective, and it's definitely an area that we could look at. But we also have to, given that problem gambling kind of falls at the end of the list of other issues, we have to figure out ways of better integration and integration of services, particularly so that people aren't going from one service provider to the next, and that there's more of a one-stop shopping.
Awesome. So I don't see any other questions. Holly had requested if you would be able to share your email after the presentation. So I guess one way we could do this is just simply, oh, wait a minute, I'm seeing just one other question. So I guess we can address that first. So maybe I could share your email just in the chat function or via an email afterwards.
Either one is great, and please, I really would like to hear from you. Happy to have further conversations, and like I said, we have this data that's becoming available. We're working on cleaning it right now, but we want to make sure that it gets translated and used, and any way that we can help your organization with the data that we have available, we're happy to do that.
Excellent, awesome, thanks, Tara. Okay, so I have a question from Blaine. Blaine says, thank you for your presentation. Can you advise if there has been any specific research on measures that can be used to identify those at risk of problem gambling at an earlier stage? That is maybe such as a tool for parents or teachers, etc. So
there has been the development of a problem gambling tool that is specific to adolescents, and it was actually developed in Canada, called the Canadian Adolescent Gambling Inventory. But the issue that lies in all of this is that it does focus on more of the later stage problematic gambling behaviors potentially, and we're just starting to explore how to identify earlier harms that may not reach a threshold of a clinical level, but might also be problematic. And sometimes that can be a little subjective. So getting back to the idea of income, you know, it may look like you didn't lose a lot of money gambling, but if you don't have a lot of money to begin with, then that loss could be really problematic and have a lot more individual level harm than, say, someone who has a lot of money, has lost a lot of money, but can afford to withstand that loss.
For sure. So I think Tanya has a question. Tanya, I can unmute your mic and I'll just do that right now.
Oh, hi there, Tara. Can you hear me?
Yep.
Okay. Thank you for the presentation. That was excellent. I am wondering if you speak to the particular pieces that can be regulated by municipal bylaws.
Sorry, okay, I think I caught half of that. So just to clarify, did you ask whether or not particular pieces could be regulated by municipal bylaws?
Yes, that's right.
Yes. So that's a good question. I think certainly there would be some related to, for example, programs and services that are provided in a community. So for example, if you have a casino that comes into a community, you want to increase your municipal services provided. But a lot of what is regulated is at the provincial level. So for example, the decision about where to put a casino is at the provincial level. And regulations related to online gambling, for example, is at the provincial level.
Right. Yeah, I'm thinking of, I guess I've been thinking about municipal alcohol policies and how we might be able to impact the substance use that happens. Yeah, just some limitations around the alcohol use in the casinos here. And I was just wondering if there are any other examples similar to that.
Not that I'm aware of, but it's certainly not my area of research, and it's something I could get back to you about.
Thank you.
Great. Okay, so I think Lindsay had a question here. So similar to the low-risk drinking guidelines or low-risk cannabis use guidelines, do you anticipate creating a low-risk gambling guideline to inform people of when gambling becomes problematic, or do you know, do you know where this might exist, or if this has been addressed in any context?
So I think this is being worked on, and GRIO probably has more resources related to that. Of course, there are, with gambling, it's a little more complex, and it's tough to it's tough to implement because something that may be low risk for one person may not be for another. Just as I pointed out with the example related to income and your ability to withstand financial losses. And it also means that we have to actually take into consideration the spectrum of harms. And really, to date, we've just focused on harms once they get to the clinical level. So but I do think it is being worked on, and I feel like GRIO has a part in that.
Yeah, so we actually, I was going to mention that to Lindsay as well, and to the group. I know of a few different studies and a few different researchers. Sean Curry, I believe is his name, has published some work around the development of low-risk gambling guidelines and what that means in the public health context. And so I can dig that up, and I can ask some of my colleagues here at GRIO, and I can make that information available after the webinar. If you have any interest in reading the article on low-risk gambling guidelines and what has been kind of done to date. So I think that was everything. Holly, I believe, has her hand up here. Holly, I don't know that your audio, I can't seem to unmute you here, but if you have a question and you wanted to just type it in any spot, whether in the private channel or just in the chat, I can ask that for you. Oh, see something come up in the Q&A here. My window is very small. Here we go. Also, Holly had asked if we can get a copy of the slides. These slides will be made available, so I will. I'll see if I can get them distributed through the list of webinar attendees. So everyone who's interested, you could either have that, or you could also email me directly, and they'll be available after the webinar. So Tanya had asked a question through the Q&A. What particular pieces can be regulated by municipal bylaws?
Okay, so again, I think that I'd have to look into that a little bit more because a lot of it is provincially represented or provincially regulated.
Okay, yeah. Okay, all right. Well, I think that's everything. I don't see any other questions. If anyone has any questions for Tara after the webinar, feel free to give me an email. I've also in the chat provided Tara's email in case you would like to contact her directly. Yeah, again, I'd like to say thank you so much, Tara. This was an excellent presentation. I'm sure everyone learned a lot. I know I did. Yeah, if anyone would like to contact Tara or I following the webinar, feel free to. And we'll be providing these slides to attendees of the webinar, and also you can find the recording of the webinar on our YouTube channel, or if you'd like to contact me directly, I can provide it to you later on. So thank you so much, everyone. Yeah, have a good rest of your day.